Hello, my name is Patrick Higgs. I'm the Director for Local Delivery for the north of Essex, working for Essex County Council within the Directorate for Adult Social Care. My area of responsibility covers both the Colchester Borough Council and tendering district. So the north east of Essex is my responsibility for all adult social care operations that take place within that zone. One of the key aspects for me within the North East Essex is about how we work with partners, and that is partners in the broadest sense, so partners both in terms of the providers of care, NHS partners, the police, voluntary and community sectors, and our communities within the North East of Essex. Amongst several challenges facing both the council and our partners is that around discharges from hospital. So we're working really closely with the colleagues in the Colchester Hospital looking at how we can support people to be discharged in a more timely and effective manner, but also around how do we work out in the communities to provide much better early intervention and prevention services to enable people to get care closer to home and to avoid the need for hospital admissions. So several of our key pressures at the moment which we're focusing our energies on is around reablement, particularly at home, but where necessary in a residential type bed. Prevention and early intervention, where we can offer wraparound care and step-up care and short-term care to enable people who are in periods of crisis to receive care and support at home and avoid the need for hospital admission. And all of that work then aligns to where people need care in a longer term setting, that we provide a better quality service available to people both in their own home and in their home if that's in a 24 residential setting. So some of our challenges are about how we work with communities and how we understand how people feel and think about the types of care and support that they need and how they access that in a different way, and ensure that they are particularly focusing around the Good Lives initiative, that we give them a better opportunity to be able to make choices themselves and take greater action themselves, rather than having greater intervention from statutory services such as the council and NHS partners. But also it's about how we work with you as providers and how we can support you to develop a better quality service, working particularly around the partnership approach, so understanding from a co-production how we can develop services and the service offer better, how we can then focus on improving the quality of our services, working with the Care Quality Commission and working with partners in the commercial and contracting teams within Essex County Council and elsewhere, how we strengthen the quality of services, but also focusing particularly on the workforce and how we ensure that we recruit the right members of staff, how we train the right members of staff, how we develop a flexible workforce, and how we invest in them to make sure that the retention of quality workforce continues, and therefore that allows us to have a continuous improvement on the quality that we do. And fundamentally all of those aspects of work that we focus on is about providing better outcomes for people in the north east of Essex and ensuring that they have a greater quality of life and better choices for them.